Hi. What I'm going to talk about now is COVID-19, which is obviously very topical. So I think one of the best ways to start about this is what is COVID-19 and where did it originate from? And I truly believe, unless you've been living under a rock for the last year, many aspects of this should be fairly explanatory. Coronavirus is a large family of viruses that causes illness in animals and humans, and we've known about coronavirus for over 80 years. In humans, several known coronaviruses have been known to cause respiratory infections, and ranging from common cold to more severe diseases such as severe acute respiratory syndrome, SARS, Middle East respiratory syndrome, MERS, and coronavirus, the disease that was coined in 2019. COVID-19 itself actually means coronavirus identified in 1919. So a lot of these diseases are self-explanatory. Like I say, it's very important to understand that this is a virus. It's not bacterial, much like influenza, the flu, which is also viral. It's very important to distinguish it from flu. Coronavirus is not flu. How it attacks the body is in many ways very different. And the disease it's lumped in with SARS and MERS have a huge body count. One of the reasons why the Asian response to the coronavirus back in January, February 2020 was so aggressive was because within a decade previously, they had been exposed to severe SARS and MERS outbreaks. Remember the H1N1 duck flu, and everything that went on in the early parts of the millennium. In South Korea, they suffered a 40% mortality rate with the SARS outbreak. So it's a good reason why the response to coronavirus in its initial phase was so aggressive, which is one of the reasons why they dealt with it so well. They understood from a very early stage what they were dealing with. Obviously, it's identified in Wuhan, China in 2019. All the markers of it show that it's not it's not man-made. It wasn't made in a laboratory. Things like this have very stable genetic markers. COVID-19 is caused by the virus SARS CoV-2, which makes it a SARS disease. And early in the outbreaks, many patients were reported to have links to the large seafood and live animal markers. Later, no links to the markers indicated person-to-person spread of the disease, and travel-related exportation cases were simply resulted from that event. So there's no question the epicenter of this disease was Wuhan. It's fairly, they're all centered around this particular market. How's it transmitted? Well, the primary transmission of COVID-19 is from person to person through respiratory droplets. Droplets are released when somebody talks, sneezes, or coughs. Infection droplets can land in the mouth, nose of people who are nearby, and possibly be inhaled into the lungs. It may also be spread by touch contamination of objects where those droplets have contaminated, which is why hand washing is such an important element. And recent data suggests that transmission by people who are not showing symptoms is becoming relatively common, and current data does not support long-range aerosol transmission, such as with measles or tuberculosis. I mean, these diseases are well known to spread over large vector patterns. As with many respiratory pathogens, short-range inhalation aerosol is possible for COVID-19, particularly in crowded spaces and inadequately ventilated spaces very early on in the outbreak. The crowded places in Asia with very poor air conditioning were highlighted to be particularly problematic. What symptoms do you get from coronavirus? Well, estimated incubation period is from 2 to 14 days, with a wide range of actual symptoms. Fever, chills seem to be very common. A persistent barking, cough, shortness of breath, and difficulty in breathing. This is as the inflammation sets in the respiratory membranes, the surface surfactants grows, headaches, nasal congestion, and runny nose. Generalized muscle aches and body aches, a deep sore throat, loss of smell or taste have been fairly common, and diarrhea may be present in some patients. Now, it must be highlighted that that many patients who contract COVID-19 are actually asymptomatic. So many people may have mild to moderate levels of these symptoms. So certainly there's a genetic element in this, and certain groups do seem to be much more susceptible to the very severe variant of this. In some cases, people who get COVID-19 can become very seriously ill and develop breathing difficulties. These are severe complications which can certainly lead to death. And the risk of severe disease increases steadily as people age. And there's certain evidence, and I can speak for this with a degree of knowledge, because I am an intensive care specialist by trade, and at the height of the peak of the coronavirus, I actually worked in quite a few intensive cares, treating hundreds of critically ill coronavirus patients. So certainly it tends to affect the old, and the Southern Asian, Middle Eastern, Afro-Caribbean, West Africans seem to be heavily affected, and there's probably an underlying genetic marker for that. Those of all ages with underlying medical conditions appear to be a higher risk to develop COVID-19 compared to these without these conditions. When you actually study all the death rates, the amount of people with a very high amount of comorbidities is very obvious, and it's very important to note and highlight that coronavirus, COVID-19, is not influenza. In susceptible individuals, COVID-19 initiates a SARS/ARDS response. ARDS is acute respiratory distress syndrome, and very often the patient will get a massive inflammatory response. We call this a SIRS response, systemic inflammatory response. And this has had catastrophic effects, leading to high amounts of multi-organ failure, huge amounts of casualties requiring renal support and such like. And, at the very early start of the outbreak in intensive care, we were seeing an 80% death with people who advanced to multi-organ failure. So it was generally a very depressing picture. And the really worrying thing that evidence suggests that long-term effects can persist with individuals who have only suffered mild to moderate original symptoms. And obviously, I'm giving this presentation for the benefit of diver medical techs. This may have severe effects long term on people's dive medicals. So we still aren't completely sure about what sort of this effect it's having, but there seems to be emerging evidence that it does have long-term scarring and inflammatory effects on the lungs. And like I say, this is a situation that seems to be changing almost on a weekly basis. Okay, What is the treatment for coronavirus if somebody does in fact contract it? Well, the current care for patients is primarily supportive, symptom relief. And in fact, back in April, that's all we could really do. We ventilate people, and we put out fires, medical fires wherever we found them. We manage respiratory and other organ failure, and the type of ventilation that these patients need tends to be very high end. And certainly what we discovered is early ventilation was fairly mandatory, because if you waited, the mortality rates dramatically increased. There are no specific antiviral treatments currently licensed for COVID-19, and none that I've actually used have shown any effect whatsoever. Now, there are many new treatments that have come along. Remdesivir, which is also an investigational drug, initially showed very, very positive effects. Try and get your hands on it now, because America have swamped up the whole world's supply. But certainly, patient survival rates who are fairly acutely ill tend to improve when they're actually giving this drug. Hydroxychloroquine, which has been touted by some people, and particularly on social media, does not work. In fact, there's strong links to increased mortality rates on patients who are having this. Dexamethasone, I'm proud to say, a British innovation, this has shown dramatically increased survival rates on patients who are becoming quite critically ill. And convalescent plasma, actually taking blood plasma from people who've had a strong COVID-19 exposure and have managed to recover from it, so we can leach out their antibodies to give back to critical ill patients, is shown great promise. So there certainly isn't a cure, but there also is not a treatment. And as we're aware, no vaccine is currently available. I'm currently recording this in October 2020. Hopefully this situation will change soon. So the main thing that we know is the practice of preventing or stopping the spread of the infection remains the greatest tool in our fight against COVID-19. The offshore industry has been exceptionally robust in its response to the pandemic, and I would point you towards several INCA documents that evolve on a weekly basis in response to new information. So the response, particularly from INCA, has been quite strong. Many companies have invested heavily in pre-screening, and the amount of quarantining before people board ships, and obviously the offshore industry is a multi-billion-dollar industry, and the amount of investment placed in place to protect this industry has been fairly dramatic. So many people are quarantining and going through a pre-screening process, which includes PCR testing actually at the site. And they're only allowing access once they've gone through that quarantine and then screening process. So essentially, the offshore ships are operating as a COVID-free bubble, and strict adherence to social distancing regulations has proved really effective. Right. From bandwidth point of view, I'm going to break the presentation there, and I'm pleased if you'll start back onto part 2 in a moment.